As the potential merger of two major healthcare systems draws closer, more people are speaking up and they're criticizing this move, and that includes our Attorney General, Keith Ellison. Jennifer Hoff is here with more on where we're at right now with this Sanford-Fairview merger.
It's a story I've been covering for a little while now. It's a complicated one, Jana, but if all goes to plan here, Fairview Health Services and Sanford Health would consolidate on March 31st. It's a takeover that the two have tried once before. But people put a stop to it then for some of the same concerns that they have now. Mega mergers could lead to worse patient care and higher costs.
2 months ago, Fairview Health Services and Sanford Health agreed to merge, a move the two systems first tried 10 years ago. It faced sharp criticism then. And now, people are publicly sharing similar concerns at several listening sessions across the state, including one last night in Worthington, comprised of the system's leaders and former nurses who worked at the city's hospital that Sanford took over in 2008.
We were told there would be no changes. The general feel went from friendly hometown care to big business and profits first, patients second.
Where there was worry, though, there was also some praise, in part from a reverend who runs a free health clinic.
Sanford Health, now a critical part in our ability to deliver accessible, timely, and quality care to our community.
Founded more than 100 years ago, Sanford is based in Sioux Falls and is known for serving rural populations while rooted in the Lutheran Church that already operates 20 hospitals in Minnesota, while Fairview is a nonprofit that partners with the University of Minnesota and its medical center, a hospital Fairview owns, but now the U wants to buy it back and build another, a move announced only when this merger was made more clear at a news conference a couple weeks ago.
It advances care.
The U also saying its interests have not been adequately considered, according to Minnesota's Attorney General Keith Ellison, who's now asking to delay the March 31st merger, calling its current timeline a concern, a sentiment shared by several unions as well, including the International Association of Machinists and Aerospace Workers, or IAM.
What is IAM's biggest concern when it comes to the proposed merger?
When we're talking about healthcare mergers, we have to first look at the research. And what the research from the Kaiser Family Foundation tells us is that these types of corporate healthcare mergers frequently result in higher costs for patients. What there isn't any indication of is any increase in the quality of the services.
IAM represents about 400 healthcare workers in the upper Midwest. 100 of them are nurses, personal care attendants, and dietary aides at Sanford that did successfully merge with the Good Samaritan Society in 2018. IAM saying, though, Sanford then shut down 9 nursing homes.
Listen to the people who are on the front lines, slow down, review the evidence, and after you do all of that, then come back and reconsider your decision.
A big theme here tonight, slow down a little bit and let's listen to what all these folks are saying. In its latest statement, Fairview says the merger is about doing more for those that they serve, and any delay is a missed opportunity to realize all of the benefits for its patients. Meanwhile, Ellison says that he is waiting for a formal response from both Fairview and Sanford on whether they will agree to push back that March 31st date. In the meantime, Jana, there is one more community listening session that is happening next week on Tuesday up in Grand Rapids.
And Jen, the Attorney General is putting on those listening sessions, right? And so that's kind of where they're getting lots of people have lots to say. Maybe we're going too fast?
I think it's important that we're holding these listening sessions just so that we can have a lot of opinions. And there are a lot of people at them on both sides of the issue. It's just, I think a lot of these voices that we're hearing from have, frankly, very valid reasons about why we should be putting the brakes on this, at least for now.
All right, well, much more to come on this all the way till March at least. Thanks so much, Jennifer. We appreciate it.